Yeah, awesome. Hi guys. Thank you all for jumping on today. I'm super excited to get into this panel and learn more about the uniqueness of being a dietitian and a PA. Probably a lot of people don't even know that that's a possibility. So you guys have so much great things to share today. And we'll start with just going around telling us a little bit about yourself, your current role in your work setting, and where you completed your dietetics program and PA school. We may have some fellow alumni or current students. So I'll have Cassidy, you start off with that.
Perfect. So I've been a physician assistant about a year and a half. I work in motility gastroenterology at Aurora St. Luke's in Milwaukee, Wisconsin. But I did my dietetics training in undergrad and for the MSDI at St. Louis University. So I hope there's some alumni on here. Go Billikens. I truly loved my program. And then I went to school for physician assistant studies at Missouri State on the other side of the state. And as a dietitian, I worked mostly outpatient. I did some retail nutrition at Hy-Vee for a while, but I worked mostly outpatient clinical at a large medical group, and then in DaVita dialysis just for a hot second before going to PA school.
Fantastic. Thank you. And Colleen?
Yeah, so I'm from South Florida. So I have been a PA for 7 years, and I went to Nova Southeastern University in Davie, Florida. And prior to that, for being a dietitian, I went to FIU in Miami. So that's Florida International University. And I actually graduated from being a dietitian in 2011. Then I worked for several years, about 4 or 5 years before going back to PA school. So a really great clinical experience. I mostly worked inpatient. In hospital settings in the ICU, trauma ICU, and then towards the latter end of my career, I transitioned to outpatient in pediatrics, and that's really where my love for kids was sparked. And so now as a PA, I am a pediatric PA, and I have been since I graduated PA school. So I work at a really big group called Pediatric Associates.
Amazing. Thank you. And Caroline?
Yeah, thank you. Hi, everyone. Thanks for joining this session. I know it's kind of niche, so we're happy you're all here. I graduated, so I was always a non-traditional student throughout my entire journey. My first life was as a classical musician. I went to a music conservatory and realized that just wasn't for me. I had to take one science class out of the whole thing. That happened to be nutrition. So I transferred to Iowa State University, where I completed both a BS in dietetics and then a Bachelor of Arts in Music, because I'm not a quitter. And then went on to fulfill my dietetic internship at the Minneapolis VA Medical Center, which I was very blessed by because that's one of the only paid internships. So lived in the Twin Cities for a while. I'm from Des Moines, Iowa originally. I happened to land into the field of pediatrics as a dietitian for my first position out of school. And that's where I stayed for the entirety of my career as a dietitian, worked as an RD for about 7 years before pursuing PA school, which I just completed in December of 2023. So I am a new grad PA, but not new to the clinical world by any means. I'm currently working in the Midwest still. As a dietitian, I skipped around to different hospitals working outpatient peds. I worked at Mayo Clinic for the largest time, and now currently work in the specialty of endocrinology as a PA. I also
Amazing.
work in urgent care too. So that's just kind of a thing I do on the side, but just to kind of let people know that you can do multiple things as a PA.
Yeah, fantastic. I think that's something that you might not think of as a nutrition student or dietitian too, just because that's not typical for dietitians, but that's
Right.
work there as a PA. And you guys all have very different paths and passions within mixing those roles together. So it's really interesting. And then we'll go back to Cassidy and then to Colleen and Caroline for this next question as well. So for those here who are curious and wanting to go into the PA field, what was the process like for you becoming a PA? And at what point did you decide that you wanted to pursue another healthcare credential?
Yeah, so for me, it just kind of fell into my lap a little bit, as far as I had been around PAs my entire life. I'm a military brat, so we have a lot of physician assistants at the clinics on base. And I went to St. Louis University for my entire dietetics education, and they have a PA program. And I honestly never stopped to think about what PAs do. I saw PAs all the time, never really thought about it until I was a dietitian. Like I said, I worked mostly outpatient clinical, and I was working with a patient doing diabetes education, and for whatever reason had to message their provider, who happened to be a PA. And that was the first time that I was like, wow, PAs can provide medicine and you can manage your own patients. Like, what is this career field? From there, I went home and like looked everything up, and probably within a week, I was enrolled at a community college to start taking prerequisites, just because when I went to school to be a dietitian, I never took anatomy. So I had to retake a few classes to be able to apply. The process of applying to PA school, because I saw somebody ask about that, we can talk about probably in the Q&A, because it's a little windy and twisty. But so for me, I took my prerequisites at a community college, and then applied to 2 PA schools. I would recommend applying to more than 2 if anybody is actually applying. It's pretty competitive. A lot of them do rolling admissions, but yeah, from there, I went to Missouri State, which is an awesome program. It's 24 months. There's benefits, pros and cons to whatever program that you choose. But it was a great fit for me. And every state is a little bit different as far as practice, but being a PA, I don't feel like I'm limited. It's that I can do even more than I was able to do as a dietitian, but I'm building on those skills all the time. So for me, working in gastroenterology, I end up doing a lot of gastroparesis diet education. I end up kind of myth busting with a lot of IBS patients for all these different fads that are online. I do see patients in motility clinic with eosinophilic esophagitis, and I do some elimination to the 6 food and 2 food elimination diets. So I'm able to build on the skills that I already had as a dietitian and learn a lot of new ones along the way, which was pretty exciting. And to Caroline's point, the really cool thing about physician assistants is you can work in multiple fields of medicine, but you can also change. So gastroenterology was a great fit for me. This is my first job outside of PA school, but I also was interested in endocrinology, and I also was interested in nephrology. And if I wanted to change, I could. But right now I love my job. So
Yeah, there's so much versatility too. And
yeah,
similar to the RD field, but also getting more onto that medical side and the science and all that, all the different fields that you can change into too. So it's interesting to note that even though you're working in one setting now, you can develop and work in another setting as a PA too. Awesome. And Colleen, I can repeat the question too if you need. But...
Oh no, I remember it. Yeah. What I love about this group is we've all actually worked as dietitians for a while. We didn't just go to school and then change our minds and become a PA. And I think there's so much value in that, because that is where you get clinical experience. That's where you meet doctors, PAs, nurse practitioners, because there are a lot of similarities in all of those fields. And I can speak for all of us. I know we're very confident in knowing exactly why we wanted to be a PA and not a nurse practitioner and not a doctor. Although they practice very similar, there's differences. And so there's so much wisdom and experience and things that you can learn from being a dietitian that I would highly recommend. And I think now is such a great time to be a dietitian, because there's so much interest in nutrition, and society really wants better nutrition care for their patients and for themselves. So I'm so excited about this field. And I didn't become a PA because I didn't like being a dietitian. I think there's that misunderstanding that when you move on towards something else or you get a different credential, you hated what you did. I loved being a dietitian, and I still consider myself a dietitian. I loved everything about it. And I loved the fact that I actually worked in a lot of different fields. I started in clinical, because that's usually the easiest job that you can get, working in a hospital. Gained so much experience. And the best part about working in a hospital is, like what Cassidy said, you're surrounded by medical professionals that you can just sit and chat with. You can't get that anywhere else, because you have this relationship and this professional friendship with them that you can kind of like, hey, can I ask you a personal question? What's it like being a PA? Do you like being a doctor? Right? So there's so much value in that sense. But after being in clinical for a while, I kind of wanted to do something else. as you can tell, I kind of have a high energy. So not that I get bored easily, but I really enjoy challenges. So I switched to doing my own business. I had my own business in weight management and diabetes education. And then I actually switched from that and worked in pediatrics, which I had never done before. But all along, I had fantastic mentors kind of guiding and leading me and just giving me these opportunities. And that's only done through relationships. You have to ask, and you have to get people's opinions, and you have to ask for opportunities. So in college, I was the assistant of Nancy Collins, who's actually a really prolific author on wound healing. She used to have a really big website. So I was her little assistant, making like $10 an hour, writing her emails and doing whatever project she wanted. But the doors that she opened for me were amazing. And then Pediatric World was opened to me by Lucille Bessler, who used to be the past Academy president. And she's just been a dietitian in South Florida for a very long time. She's very well known. And then in pediatrics as outpatient, that's where my desire to do more on the medical team was really sparked. I felt like, gosh, I could do so much more. And I wanted to do so much more than just talk about a tube feeding, or then just talk about what foods the child can or cannot eat. And so, like Cassidy, I only applied to 2 schools, which highly, highly not recommended. But that was, gosh, 7 or 8 years ago. So a little less competitive, although still extremely competitive. I would recommend you apply to more. But I got into my school of choice and have never looked back, and really love marrying the two between medicine and nutrition in pediatrics.
Amazing. And that's such a great point that you make too about you didn't become a PA because you didn't like being a dietitian. It's all about really expanding your scope of practice.
Yeah.
As the title of our session is. Thank you. And Caroline?
Yeah, I'll try to make this short, just because I want to echo everything that everybody's said so far. I cannot emphasize enough what Colleen just said about the fact that we didn't not like being dietitians. Honestly, I account my success getting into PA school, becoming really a successful PA in practice, to my dietetic background and the analytical skills that you get from, thinking on your feet as a dietitian, the communication skills, the motivational interviewing skills that you get. Everything is all interconnected and so transferable. My journey into the PA route, I guess, was one that ebbed and flowed and evolved over many years. It really did start in my dietetic internship. Surprisingly, I felt like my internship was extremely clinical and almost somewhat medical in a way at the VA. I had the opportunity to observe open heart surgery in my dietetic internship. I got to do my capstone in association with the autopsy pathology program, where I did kind of an M&M morbidity mortality case where my patient who was diagnosed with toxic megacolon on TPN that I was managing actually passed. And I got to show like pathology slides and work with them. So very interdisciplinary in kind of a quirky way. And it just kind of sparked my interest for medicine actually at the very beginning. And I would see that interrelationship between medicine and nutrition from the get-go, essentially. One of my preceptors in my dietetic internship, his wife was an RD, very successful. I looked up to her. She went on to be a hospitalist PA and decided to pursue her career. So I saw that this was possible. I saw it happening. So people I looked up to and respected were doing this. So my interest was piqued from an early age. Moving forward into my career as a dietitian, I was always practicing at the very top of my license as an RD. I worked in different subspecialties within pediatrics, so gastroenterology, where I was managing single-handedly very complex tube feeding regimens, TPN, for pretty medically complex kiddos with, short gut or food allergies, you name it. I was also the sole dietitian for several cystic fibrosis centers that were nationally recognized. And so within the field of CF, I felt in many ways the line between RD and advanced practice provider was very much blurred. So I was managing pancreatic enzyme replacement therapy. I was very much engaging with the multidisciplinary team, looking at lung PFTs, chest x-rays, because their lung function very much, per the research, is directly correlated to their nutritional status. And that's been proven through countless research and studies in the world of cystic fibrosis. So, I had that privilege of being a respected member of the team, having the physicians come to me very frequently asking for recommendations because it was so critical to the overall medical care of these patients. And that was inspiring. And like Colleen, like Cassidy both said, I found myself yearning for more and wanting to do more, wanting to just fulfill my career. I still felt I was very young and very green. I was also, I think, talking more brass tacks, I was also a graduate in the time frame where I was grandfathered into not needing a master's degree, but yet that credential was going to change very frequently, or excuse me, very shortly. And so I thought, gosh, like, there isn't, I'll just be honest, there wasn't a lot of financial incentive for me to go on and get a master's degree, at least at the institutions I was working at the time. And so I thought, you know what, this is my sign. This is my sign to just take the plunge, go for it. I wasn't married at the time. I didn't have kiddos. So I thought, why not now? So really, once I decided to apply, I took advantage of my full-time job status and my benefit of getting, tuition reimbursement working at Mayo Clinic. So I was able to work full-time and then take summer classes. I too, Cassidy, had to take many prereqs to qualify for PA school. I did take anatomy. My dietetic program required that, but there were a lot of random psychology classes that I didn't take, like abnormal psych, and I'm trying to think of another, but you get the point. I was taking classes all throughout my time working as an RD, and a couple summers go by and I applied to a total of 4 programs, and I got into 3 and waitlisted at 1. But again, I had over 10,000 hours of clinical experience having worked as a dietitian. I was a published author in the research space. I had community hours, volunteer hours, lots of times working on committees. So I kind of was able, just through being a dietitian, meeting and filling all those buckets of requirements that they look at for very top applicants for PA school. And then to answer somebody's question quickly regarding licensure, technically, although this is, very much a caveat, technically dietitian and nutrition recommendations fall under the scope of a medical provider. I will say they don't do it well. And that was a big influence for me to go on to becoming a PA. So I don't technically maintain a licensure for my RDN, but obviously I'm credentialed. So hopefully that helps answer that question.
Yeah, great. Thank you for answering that question too. And something that you all kind of touched on too was the number of PA schools that you applied to. So Colleen and Cassie, you said you applied to 2, and then Caroline, you said 4. Is there a recommended amount of schools to apply to as a PA?
Yeah, a minimum of 8 is what I'm told.
We're all pretty risky, but right, you're right. Being dietitians already,
we were
confident.
That's
true. Being dietitians already, it is beneficial in that, like Carolyn said, we already had the patient care hours and volunteer experience and all these things that made us better applicants. But in general, yeah, I was also thinking like 8 or 10 schools is what I feel like they say you should apply to.
Yeah, and I think that's also great for people here to hear if they're interested in becoming a PA, because you have that experience through our schooling and everything that we do as dietitians, where you kind of have a leg up in the PA applications. Obviously still might need to take prerequisites, might still need to get more experience, but you're not just starting from a blank slate, having no like medical or related background. So definitely a really not easy, but a connected segue through those 2 careers. And I'm going to now go into questions specifically for each of you, because you all obviously work in your own settings, and then you all also do different things on the side as well. So in addition to being a PA, I wanted to bring some attention to some of the things that you do on outside of that. So Colleen, I'll start with you. Tell us a little bit more about your Exam Room Nutrition podcast. People here may know it, may have listened to it, but I would love to talk about that and what the response is like when you're educating other healthcare professionals on nutrition education, nutrition counseling, and other topics that you educate them on.
Being, dietetics professionals, we're obviously so passionate about nutrition and making sure that it's the forefront of patient care. And I really think it's the most underutilized tool that we have in medicine right now. And as Caroline had mentioned, really, there's no education when it comes to nutrition for PAs, doctors, or NPs. It's pretty standard across the board. And a lot of healthcare professionals, although just a PA, not a dietitian and PA, but a PA can provide full nutrition education. They have that authority and that right with that credential because it is a higher level credential. They can provide that. However, they're not equipped with the tools to do so. So in PA school, I realized this, and I actually got to be a lecturer to my program. I taught a lot of the nutrition classes while I was a PA student, which was really kind of fun and interesting. But in a PA school, I'm like, gosh, we are learning nothing about nutrition. And really, I'd argue that like 80 to 90% of medical conditions have a nutrition component to it. So then fast forward to being in practice, in pediatrics, I mean, it's everything growth and nutrition for at least the first 10 years, 16 years of life. But from infant feeding, formula breastfeeding, solid foods, picky eaters, like you name it, parents have questions about nutrition. And I had so many colleagues come up to me and ask, like, what should I do with this case? Look at this growth chart. What do you think? This kid won't eat anything. What should we do? But I'm like, okay, let's make a podcast. Like I said, I like a challenge. So I have no tech background or marketing background or anything like that. But I decided to create a podcast and just create this space where I interview registered dietitians because, again, I want to highlight the fact that a dietitian is the nutrition expert, not a nutrition coach, not Susie on Instagram who has 1 million followers and a 6-pack and sells probiotics. Like, that's not the expert. The experts are registered dietitians. So I interview registered dietitians on my podcast, and we answer common questions that doctors and PAs are faced with. Like, what do you think about the carnivore diet? Should I go on a probiotic supplement? What tips do you have for picky eaters? So the listeners, who are hopefully medical professionals, are equipped to answer those questions that they're faced with every day in clinic. And the response has been awesome. I mean, it warms my heart to have really kind podcast reviews because, again, I do it myself. I'm a solopreneur. I don't have a team or anything helping me with it. So putting time and energy into like your baby and then getting a great response is so wonderful. So if you want to check it out, it is Exam Room Nutrition. That's my handle on Instagram, LinkedIn, and it's on Apple and Spotify as well too. Really quick, short, easy episodes you can listen to while you're getting ready in the morning. And Cassidy has actually been a guest as well. And we're trying to get Caroline, but our schedules haven't worked, but she will come on too. Cassidy's been on and we talked all about liver functions and the exam for, or the treatment for fatty liver disease. So it's a really, really cool podcast episode.
Very cool. I think a lot of people here would love to listen to that because I feel like even like during your clinical rotations or during schooling, you want to learn about that. And even you might not use that nitty-gritty as a dietitian. It might be more in the PA field, but being able to listen to those episodes, that's really great and really innovative that you developed that. So kudos to you for developing that. And I did drop in the chat your Colleen's LinkedIn and Instagram to Exam Room Nutrition to check that out more. And Cassidy, my question for you is about your experience as a gastroenterology PA. So I understand that you do like small procedures sometimes, which is really neat. I know in dietetic internships, sometimes we get to go watch procedures, but obviously as a PA, you get to do those procedures. You work both inpatient and outpatient in the gastroenterology field. So I'd love just to learn a little bit more about your day-to-day and how you bring your RD credential and training into your role.
Yeah, so my day-to-day, it's always a little bit of a hot mess, and I'm okay with that. That my schedule changes a lot. In theory, what is supposed to be the case is 3 weeks of a month I work outpatient, and I work in gastroenterology with an emphasis in motility specifically. And then 1 week I rotate onto the inpatient service. I work at the largest hospital in the state, so it is crazy some of the stuff that we get to see, both inpatient and outpatient. And then every Wednesday I have a procedure day. So that doesn't really change. If I'm in the clinic, some of the small procedures that I do are anoscopy. Think of like a speculum for a woman's health exam, but it's clear and it goes in the rectum. And so in the office, we're able to see things like anal fissures and hemorrhoids without a patient having to get a full colonoscopy for rectal bleeding if I can easily say it's right there, that's what's causing it. And then other procedures. So on Wednesdays, I do ambulatory pH testing. So like a 24-hour pH catheter that gets placed, and a patient would go home with it. And then we download it. I get a nice little report and can interpret if they have pathological reflux, and if they need to then go have what kind of surgical intervention for the reflux that they have. And then my bread and butter is anal, rectal, and esophageal manometry. I'm really nerdy about this. I had never heard of this before taking this job, but it is basically a catheter that senses pressures. So we have one that goes in the esophagus and another one that we place into the rectum, and we're able to diagnose disorders of the esophagus. So things like jackhammer's esophagus, where the esophagus squeezes too tight, achalasia, where the lower esophageal sphincter stops opening the way that it should. For the lower end, for anorectal manometry, things like dysynergic defecation, where the muscles of the rectum and the anus do not work together well to allow patients to have bowel movements. So those are the patients that, I mean, they've done everything. They've tried every medication, they've tried every fiber, and they're still constipated, or they tried everything and they're still having fecal incontinence. The anorectal and esophageal manometry is not the first test somebody's going to have. It's usually patients who have had problems for years and years and years. I am super nerdy about it. I love it very much. And then when I'm in the clinic, sometimes I do clinic on my own. Usually once a week, I will do a tandem clinic with my collaborating physician. I completely adore him. I work at a one-to-one clinic, so I work with the same doctor all the time. The beauty of the PA profession is we're trained as generalists. However, then we can specialize. And so I have a doctor that I work with all the time who is the director of the GI fellowship. And it's like, he is providing my education in motility. And so I'm learning on the job and loving it every day. And then when I'm on the inpatient service, it's a little less structured than clinic. You don't know exactly how many patients you're going to see. Up to 15 per day is where we have kind of landed on. And it can be anything GI related when I'm on the inpatient service. So anything from cirrhotic patients to rectal bleeding, coughing up throwing up blood, nausea, vomiting, abdominal pain. So varying levels of emergencies there. Sometimes I'm going down to the ER because somebody's throwing up blood. Sometimes I'm going to see a cute little old man who's been constipated for 15 years and they decided to consult GI. So huge range when I'm on the inpatient service, but it has been challenging now that I've been in my position for a little over a year and a half. Things have slowed down. So I just love it.
Wow, amazing. All of that, I'm sure everyone here who was in like deep into clinical rotations, or maybe not in a super clinical rotation, over my head, but it sounds amazing. And so amazing that you get to see all of these different things and apply your nutrition knowledge for them as well. Very, very cool. Thank you for sharing that. And I did drop Cassidy's link in there as well. She does have an Instagram. It's the.nutrition.pa if you want to go along and follow her. And Caroline, you do have actually a really large following online. And I actually remember, I think I started following you during my dietetic internship a long time ago. So it's like full circle for me to see your name.
So
And
cool.
that was probably when you were like transitioning more into the PA field. But so that's been a long time. But so in addition to working in medicine full time, you have that large following on social media. So when did you start your business and the content creation? And how do you balance being present in that side of things, but then also for your online community and working as a PA in all of these different roles?
Yeah, it is a lot. It is a lot. I'm definitely kind of like probably many people watching and my counterparts on the panel today. We love staying busy and we love keeping toes in different areas of clinical work and work outside of clinical care as well. So I think the key word you mentioned is being present. It's so important to be present in both, and it's quite literally impossible to be present 100% in either. So it's a game of give and take, and I constantly am at tug of war with myself. So I started my so I've been on Instagram really since the beginning, since Instagram was created. And it's started out as a personal page, as everybody did when it started. But then around 2018 was when I started focusing on my niche and making it more work specific. And it wasn't until pre-pandemic that I started to monetize it and really create products for sale that were educational and also evidence-based and beneficial for my niche audience, which were parents, because I work in pediatrics and I still consider myself to be a pediatric dietitian. And that's what I still focus my Instagram on, is starting solids education, infant nutrition, toddler nutrition, things like that. And that was my passion as a dietitian. It still very much is a passion as a expecting parent. So let's see, it wasn't until the pandemic where I felt like my account was really starting to take off, I think out of necessity, because parents were kind of stripped away from their pediatric providers in clinic and they were just grasping at straws for resources. And so I did a lot of multidisciplinary Instagram takeovers and connections and, work on my social media page. I got on TikTok when it first started, when we were all in quarantine. We all remember that time. So grew pretty exponentially during the pandemic, and then just continued to really grind. I mean, it's been blood, sweat, and tears. I've been at this for over 8 years, and it's quite honestly what helped me fund my lifestyle in PA school. Like, I would get brand deals to kind of echo off of Kristen and the session before us. That is something I've been doing for many years. I do media spots. I do blog writing for different brands. I do reels, I do video content, and it supplements my income now. But when I was a student making zero salary for 3 years in PA school, it was nice to be able to pay my rent through that. So very privileged and very blessed to have that, but I worked my butt off to get to where I am today. So, definitely recommend, if you have any questions about that, if you want to connect with the session leaders before us now, recommend it, or me, send me a DM. I'm happy to share my journey. It was a messy one though. There's no right answer to get to that. So in my clinical time, I work 9 to 5. My role as a PA is hybrid. So I work in the hospital in the mornings and in the clinic in the afternoon. So my type of patient population is all things diabetes and everything in between. In PA school, even, and definitely in dietetic school, I feel like we think of diabetes as very black and white, right? Like, it's either type 1 or it's either type 2. And I'm here to tell you that that is not the case in any way, shape, or form. There are many nuances to diabetes. There are many different genetic variants that cause different flavors of diabetes. There's gestational diabetes. I work in an OB clinic managing GDM every week. We also manage enteral nutrition induced hyperglycemia regimens, right? So when a patient gets put on TPN, let's say they don't even have prediabetes, but they have some sort of bone marrow cancer or blood cancer and are on high doses of methylprednisolone and then have skyrocketed blood sugars, we have to give them insulin for that. So my patients I see in the hospital are critically ill, and that takes up obviously 100% of my focus and time. When I'm on the clock, I am on the clock. Not thinking about anything else. And then in the clinic, I maintain a hospital follow-up clinic where people who are better and discharge home, I'm able to make sure that their insulin regimens are safe and are working effectively for their glucose control. So I also manage insulin pump regimens in the outpatient world. There's been such a blast of technology since my dietetic internship now, in terms of all the different insulin pumps and options that are on the market, CGMs, how to read CGMs, download the reports, manage those, and adjust regimens. Endocrinology is such a great specialty for dietitians. I use my dietetic background and my nutrition background every single day on the job. And it was actually one of the reasons I felt like I was hired in my current position, was because I worked in endocrinology as a dietitian before. So that was a question left in the chat, I know. So just to kind of show all of the people watching that everybody's day as a PA varies significantly. I don't work with just one PA, or excuse me, one physician supervisor. I work with like 15. So flexibility and adaptability are two skills that I have to have in my job. Kind of makes me want to pull my hair out sometimes because you can manage diabetes in lots of different ways. But being flexible is key to being a PA, as it is dietitian. In urgent care, I am the sole provider. I float between 5 different urban immediate care clinics. And so I'm diagnosing, treating, doing minor procedures. I'm prescribing medications. You know, a lot of times we see common colds, but I'll get chest x-rays, I'll treat broken bones, I'll do, you name it, anything. I'll do suturing on the spot. So that's kind of fun, more hands-on medicine where I really get to use my clinical skills. And endocrinology is such a cerebral specialty. I'm not hands-on in any way, shape, or form. I just use my brain and that's it. So I took on this urgent care role as a way to maintain a broad base, just because PA is one of the main attractive points of being a PA is that lateral mobility that we talked about. So you don't have to, like physicians, pick one specialty and stay in it for the majority of your career, or the entirety rather. You can switch between different specialties. Easier said than done, but it is possible. And because we're trained as generalists, we can do that with our credentials. So that's a long-winded answer, but hopefully that helps touch on all the different multifacets that make up my career.
Yeah, no, very, very cool and insightful. I appreciate you sharing all of that, and interesting and smart of you to, I think, take on that urgent care position, like you said, to have that to potentially switch into others, keep your skills in certain areas. And when do you fit that into your schedule? How does that urgent care patient fit into the schedule?
Yeah, so it's not pretty. Right now, I currently work more than full time. So I work a full time job in endocrinology, and then I took on this PRN role. So it's not much. I work only a total of about 10 hours a month in urgent care. So I'll take like 2 Saturday mornings where I'll go to urgent care and I will see patients for about 5 hours. So again, it's a sacrifice I'm making because I am a new grad and I don't want to lose my broad base of clinical skills that I know I would in endocrinology. And if I'm being truthful, I did a lot of things as a dietitian. I reinvented myself many times in my career. I'm not sure endo is my end all be all specialty. I love it, but you know, I want to keep my options open, as do a lot of us watching today. So that was more of a strategic move on my part, in addition to just loving medicine and loving the hands-on nature of it.
Yeah, amazing. And Cassidy also did make a point for when you're applying to jobs, some of the jobs that you get offered and the roles that you guys are in, being an RD helps with that, and you can bring that experience to the job. And thank you. I know Colleen and Cassidy and Caroline, everyone has been answering everyone's questions. So if you're on here, make sure you're scrolling through the chat. We'll give a recap of the question answers in the follow-up email as well, but thank you for going in and answering those questions. Super helpful. So we're going to do a few more questions for you all since we have those Q&A questions answered. And so this one is going to be for everyone. What out of all of you obviously have a variety of roles, internships, from nutrition, from PA, everything else, and different work experience. So what has been the most, like, your favorite or your most rewarding experience? And we'll go back to Cassidy to start with you for this one.
Ooh, like my favorite experience that I've had as a PA or during like my dietetic internship?
Either or both.
I think my favorite experience that I had during my dietetic internship was seeing how peg tubes are placed. And I was like, whoa, 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 this is too much. That tube just went through somebody. And then now I see it all the time and I'm like, oh. But that at the time, it was so cool to see how enteral nutrition worked, I guess. And now I kind of take it for granted. I'm like, oh yeah, peg tubes, like we place 5 of them a day. And I should mention that I don't do that as a procedure, but there are some PAs that I work with that do assist with peg tube placements. So
yeah, wild. And something that I think with anything, the doing it and getting used to it comes with more confidence.
yeah.
All of us, when we see that in an internship, would think the same thing. Awesome. And Colleen?
Okay, so I'll share 2 because they're kind of quick. One was in my dietetic internship. Like I said, making those relationships and those connections with anybody that's on the medical team is so important. So this was already when I was toying with going back to school. I wasn't sure what I wanted to do, but I befriended a PA, and he was actually a cardiothoracic surgical PA. And he's like, he grabbed me one day. He's like, oh my gosh, come to the OR with me. This is going to be so cool. So I got to watch a full open heart surgery, and like the media was there because it was like a really, really big case, not in the OR room, but it was a really, really big case. And I was actually the dietitian on that patient case as well too. So he, being able to experience, like Cassidy said, like a full on like procedure like that when you're a dietitian was mind blowing. And I just had so much respect for him as a PA, because what you'll find, our PAs are a group of humble, enthusiastic people who want you to learn and who love to share about their career, because we all love what we do. So if you see a PA, I promise you, go up to them, shake their hand, be like, I want to go to PA school. Like, tell me about it, or tell me more about what you do. I promise you, they're going to share so much value to you. Now, fast forward, as a PA working in pediatrics, I love the fact that I get to kind of plant the seed for what the patient's relationship with their doctor or provider is going to look like for their life. If they trust and know that me as the provider is here in an open, welcoming, loving, fun relationship, and this is a place where you're safe, they're going to carry that with them through their whole life, to where even like more important screening things like colon cancer screening and testicular cancer and all those other things that you have to screen for when you're a little older, they'll go and do, because they've grown up with such a loving space. The other thing that I love about pediatrics is the ability to reframe how they view themselves and their bodies. And we have such a power with our words to just promote body confidence and love regardless of their body size. And I'm super passionate about kind of teaching clinicians how we need to talk about a child's body and the transitions and the changes. And I've had, countless patients and parents tell me that they're so thankful for the way that I addressed maybe a child who's going through puberty, his body weight that might have been on the upper end, but how I addressed that with such care and confidence that it completely changed the trajectory of their life and how they love and accept themselves. And I think that's such a unique role that I get to play.
Yeah. Wow. You really get to have such a special part in their lives. That open heart surgery too. That sounds pretty wild.
Yeah.
And Caroline.
In my dietetic internship, granted, I was working with veterans, right? So older, mostly gentlemen, of Vietnam War era, because that's, the age we were in. But my internship allowed for a lot of unique opportunities outside of that home base and bubble. And one of those was within an eating disorder treatment center at the Emily program in Minneapolis. And so it was there I got to see the unique niche of eating disorder treatment as a dietitian. I gained a lot of skills and insight as to how to manage that appropriately. And most interestingly for me was a specialty niche within eating disorder treatment, which was the dual diagnosis of anorexia, bulimia, and type 1 diabetes. So when individuals, mostly adolescents, were, willingly withholding their insulin as a way to lose weight, thinking about your physiology there. And so that was a very unique area. And I felt like I gained such a unique insight into that specialty. So that was kind of a thing that stood out for me. Additionally, a lot of the psych kind of influences that nutrition played. I worked with a lot of veterans with PTSD and bipolar. And so how a lot of the psych meds, which promote extreme weight gain, is just kind of a necessary evil with that class of drugs, how that affected their relationship with food. And so I felt like, we made a pretty big difference as dietetic interns with that patient population. Fast forward to now as a PA, I've got so many stories from PA school. I had an amazing PA program where I got to do a lot of electives. I did mostly surgical electives, actually, and I love being in the OR. Being able to suture up my first case by myself was an incredible moment. I felt like it was a pinch me moment, like, wow, I've made it, mom, type thing. I also got to first assist on a vaginoplasty where we had a transgender patient who was undergoing gender confirmation surgery, and we actually, I don't know if I can say this, it is a medical term, so I'm going to say it, we created a vagina. It was just mind blowing. And so cool. One of the surgeons is a lead surgeon on that in the country, and so to be able to first assist and be on that was just insane. So lots of amazing experiences during PA school. For those of you curious, I went to the University of Nebraska Medical Center in Omaha, was the school I went to. And I chose that program because she's no longer, but at the time, our assistant director was actually a dietitian, gone on to be emergency medicine PA. She was a total badass. But anyway, now in my job, you know, I'm still very new to it, so I'm still learning every day. I can't, to be honest, think of one like amazing, mind-blowing thing that I've experienced yet in my job, but it's kind of just that consistency. Like every day I go in, I put my best foot forward, and I know I'm making a difference. And so, you know, medicine is kind of a thankless specialty. I'm not getting like pats on the back or affirmation from patients like, good job, you're doing so good at managing my diabetes. Truthfully, they kind of hate seeing me when I come in. So it's a little hard versus pediatrics. I feel like parents are like, oh my gosh, thank you. You got me to help my kid grow accordingly. Like there's a lot more affirmation in that specialty. You know, obviously not saying, I'm painting it with a really broad brush, Colleen. You do incredible things, and pediatrics is one of the hardest specialties in my opinion, because you get 2 patients in your room every time. But you know, I think I just have to remind myself I'm doing good work, noble work, and just gotta keep at it every day.
Amazing. So many cool experiences that you all have had, and really appreciate you all sharing those today and inspiring students and current dietitians who are looking to be PAs. And we're going to end with this question for all of you. So if you could give one piece of advice to a future or current dietitian who's interested in pursuing PA school or even another healthcare profession, what piece of advice would you give them? And we'll go back to Cassidy.
Okay, this is going to be so simple, but my advice would be that if you think you're interested in the profession, but you're not sure, the best way to know is to shadow. Honestly, applying to PA school, they're going to want you to have shadowing hours at a lot of schools anyway. As far as how to set up those shadowing hours, you know, everybody on here presumably already wants to be a dietitian. So when I was a dietitian, I just messaged all the PAs at the hospital I worked at and asked if I could come shadow them after I was done with my own clinic, and they were agreeable. But that's how you figure out if this profession is for you, if it's something that aligns with your goals. I answered earlier in the chat somewhere that I love being a dietitian and I love being a PA. They're very different at times. I never get to leave early anymore. You get a ton of e-advices, a lot of medication refill requests, sometimes with vacations. You know, you have to have a real plan for who's going to be refilling your patient's medications and things like that. So a little bit of extra stress. But to know if that's for you, just see how other people are managing it. And then you'll have some exposure to different departments that maybe there's not often dietitians in. So I did a lot of shadowing in dermatology and ortho, not because I like dermatology and ortho, but I just had never really been exposed to it before.
Yeah, great advice. Get that hands-on experience and see what it's like, or shadowing hands-on experience. And Colleen?
So I have 2. My first one is if you're considering going to PA school, but you're already like super close to finishing your dietetics career, or you're about to graduate, even if you're a few years into it, I wouldn't quit that. I would highly recommend you get your credential as a dietitian, because it makes you 100% times more likely to get accepted to PA school than someone who doesn't. Like we've all said, like the shadowing hours that we got, I didn't have to get any extra, because my job as a dietitian, that's all I wrote down. I mean, that's patient care experience. It's so valuable that literally, like, I walked into the interview and they're like, no, you're awesome. Like you're in, like you have everything we want. You know, it was like amazing. So the experience that you get as a dietitian, I cannot applaud it more. So I would recommend go for it, be a dietitian. The knowledge too that you're going to get in school now as a dietitian will help you so much in PA school, because you don't have to study for the nutrition part of stuff. So it's like one less thing you have to know. Secondly is don't let your age, your marital status, or your parent status hold you back from doing something that you want to do, whether it's going for your RD degree, whether it's going back to school as a PA. I mean, we're all kind of second career PAs. Now, I'm actually a mom. I'm a single mom. So I had my daughter in college. I was breastfeeding in college and finished my college degree as a mom of an infant. I worked full time as a dietitian. Then I went back to school as a PA when my daughter was 5. So she was starting kindergarten and I was starting PA school. And she literally was like, "Oh, Mom, we're starting school together." So don't let any of that hold you back, and don't believe those lies, because if you want to do something, whether you're a mom, dad, whatever in between, you can totally do it. It's totally feasible. So I just applaud you guys all for your paths and your career, and we're here to support you on everything that you do.
Amazing. Such great advice also. And you have some comments in the chat there too. Very cute with your daughter there.
Thanks.
Wow, Colleen, I had no idea that was your experience. I just want to commend you. That's incredible. You are such a strong and inspiring person. I would also say that I attended PA school amongst other parents, and they were providers for their family. So again, don't let that stop you. I think that's a great piece of advice. Don't let the financial fears as well stop you. I took out max loans. There's no other way to do it. I was used to having a full-time salary as a dietitian, and then I went on to having nothing. Granted, I had, my side hustles and things to help support, but definitely loans are just how people do it. And there are opportunities now. Hopefully they stay for loan repayment based on the type of, facility you work for. If it's a, academic teaching institution or what have you, like a 501c3 nonprofit, which I do currently work for. So that's a big one that I get a lot. I would also just echo the fact that being a dietitian, getting that credential, getting that boots on the ground experience is what's going to set you apart as a PA. It's going to be what makes you a better PA. So all of that. And then I just want to end, because I think it's kind of a theme and just overarching way to explain my own experience. And that is, never be afraid to reinvent yourself. I've done it now 3 times, and it's hard, it's scary, but it is very possible. So I'm happy to, help people to the best I can with questions. If you guys want to reach out to me personally, I'm at The Clinic Dietitian on all social media platforms. I dropped my email in the chat here. I know myself and everybody else on the panel will be more than happy to answer your questions.
Amazing. Thank you so much. Unique experience that we wouldn't hear as dietitians normally. So very, very grateful for you all being here today and sharing all of these experiences. There's a lot of inspiration. A lot of people felt what you were saying and took to heart. So thank you for sharing such detailed experiences too, and for being with us today.
Thank you.
Thank you so much. This was so fun. I'm so excited to hear your journey. I'll speak for all of us, because I know if you follow us on Instagram or any of the socials or email us, tell us where you're from, because it's hard to know that when we get random followers. So just shoot a DM and be like, "Oh, we're on the summit," because we want to know.
Yeah.
Yep. This is so exciting. I'm excited for everybody. I hope everybody's excited after this. I'm like, I could do this for 5 hours. Sorry.
Same. Talking shop all day is the best.